I'm Dr. Fraser Birrell. I'm a consultant rheumatologist with Northumbria Healthcare and an honorary clinical senior lecturer with the Musculoskeletal Research Group at Newcastle University, where we're involved with lots of studies with the Arthritis Research UK. Many people that I see who suffer from joint pain in their 40s onwards believe it's caused by decades of general wear and tear on the joints. This isn't true. A crucial thing to understand is that if it was wear and tear, then we would all develop arthritis if we live long enough. And that's simply not the case. Years of research into arthritis and other related musculoskeletal conditions have replaced this outdated, inaccurate and very negative view with fresh scientific evidence and thinking. And now we use the terms tear, flare and repair to describe what is actually happening. So what we need to understand is what are the key factors which are leading to and causing these episodes of inflammation and leading to the episodes of pain. That includes malalignment of the joint. For example, if you've got malalignment where your knee throws out to the side and it puts more pressure over the outside, that can lead to pain and pressure. Obesity increases the load. Specific types of overuse where you're using your joint more than it's designed to be used. And sudden movements, particularly those that lead to injury and strain. Those are all potentially factors. It's very common for patients to tell me that they get dull pain the whole time, or some of them will be pain-free. And then they'll get a bad episode of pain, a flare, where the pain goes right up. And that has big effects on your function and your day-to-day activities as well. What happens is it's the cumulative damage from repeated injuries, and some of them are true injuries which would lay you up, and some of them are subclinical injuries. The important thing is if they lead to an imbalance in the normal functioning of the joint, the normal alignment, that's what increases the load, that's what increases the pressure, that drives the inflammation, and that causes the pain and causes the damage to the joint over time. So when you've got that severe pain, my patients tell me that if they try and get an appointment with a GP, they can sometimes have to wait several days. So what they need is access to something which is going to give them relief quickly, something which is easily accessible, preferably something they can get from the local pharmacy.
Hi, I'm Dr. Natalie Carter from the charity Arthritis Research UK. For the last 80 years, we've been funding groundbreaking research into joint pain and arthritis for the millions of people who live in pain every single day. But our work doesn't stop there. We want to support people so they can break through from their joint pain and get on with their daily lives. So the repair process is both an automatic response of the body, but also a process that you can actively help. Education on this repair process is crucial, especially when it comes to self-management, exercise and weight management. So we've put together 5 top tips that we think could help. So firstly, we'd recommend taking regular physical activity. This helps to build up muscle stamina and gives lots of mobility and stability to the joints, and it can help to protect you in the future against injury and flare-ups. Great examples of low-impact physical activity include swimming, walking, cycling, stretching and yoga. It's really important to remember to warm up and cool down before and after exercise. For people with joint pain, we know that sometimes things can hurt. We would suggest that if you just do a little and take lots of rest, rather than giving up something that you really enjoy. Secondly, try and keep the ideal weight for your height. Being overweight can put additional strain on weight-bearing joints. This includes the back, hips, feet and knees. Thirdly, as carrying heavy items can cause pain in the shoulders, arms and hands, do not forget to prevent future flares by distributing the weight across multiple joints. And if you're carrying, lifting or pushing items, always use the correct techniques. Another important thing is to follow a healthy diet. A Mediterranean diet is a great example. So this includes lots of fruit and veg, fish, nuts and olive oil. This can help contribute to giving you a healthy weight, can help to reduce inflammation and can also contribute to having healthier joints. Lastly, we know that living in pain every day causes fatigue, and this makes everyday tasks difficult. We'd suggest getting a great night's sleep and then thinking about the day ahead and prioritising. This helps to pace yourself and make sure you don't get overtired. It may take time to notice results, and by making changes early, you can help to avoid problems and flare-ups in the future. So it's always best to seek advice from your healthcare professional.
Hello, I'm Raj Rahila. As a community pharmacist, I see many people suffering from troublesome, flaring joint pain every day. In fact, it's one of the most common conditions we see. This could affect anyone at any time, whether they be young or old, male or female, whether they do sport or any other physical activity. People come to us in distress and in considerable pain. They tell us that doing simple daily activities like driving the car, climbing the stairs, or walking to and from shops is a lot harder. Flares can really disrupt sleep patterns, making people feel totally wiped out without any energy or strength. Therefore, managing flaring joint pain is both a physical and an emotional challenge with a negative impact on daily activities and quality of life. That said, the most important need the patients have is an effective treatment that tackles both the pain and the underlying inflammation. Many of the people I see with flaring joint pain are regulars to the pharmacy, which is great because I can work with them to develop a specific and a holistic self-management plan. This can include ongoing support strategies as well as addressing the immediate needs to address their pain and inflammation using appropriate analgesics and anti-inflammatories when their joint pain flares. This can include regular use of ice packs or joint supports such as bandages or braces, as well as more healthy lifestyle support to help manage their weight and improve their mobility. Our aim is to help shift people's mindsets from a passive, symptomatic treatment to a more active, holistic approach to manage their joints using sound evidence and advanced medications. Our ultimate goal is to help them self-manage their condition and keep active.